What causes a child's chronic morning cough? Imagine waking up each day and having a persistent cough that just won't go away. If your child has been coughing every morning for more than weeks, it's important to understand what might be causing it. Several common conditions can lead to a chronic morning cough in children, and knowing about them can help you decide when to seek medical advice. One of the most common causes is asthma. Asthma involves inflammation and narrowing of the airways, which can make breathing difficult and cause coughing. Children with asthma often cough more in the morning or at night because their airways are more sensitive during these times. Triggers like allergens, exercise, cold air, or respiratory infections can make asthma symptoms worse. Sometimes, a child might only have a cough without other obvious signs of asthma, so it's important to get checked if coughing persists. Another frequent cause is post-nasal drip, also called upper airway cough syndrome. This happens when excess mucus from the nose or sinuses drips down the back of the throat, irritating it and causing a cough. Mucus tends to build up overnight while the child is lying down, making the morning cough worse. Allergies, sinus infections, colds, or ongoing nasal congestion can all contribute to this. Along with coughing, children might also clear their throat often, have a runny nose, or feel stuffy. Gastroesophageal reflux disease, or GERD, is another possible reason. GERD occurs when stomach acid flows back into the esophagus, irritating the throat and airways. This often causes a cough that is worse in the morning after lying down all night. Children with GERD might also complain of heartburn or chest discomfort, especially after eating certain foods. Sometimes, a lingering cough after a cold or flu is due to post-infectious cough. Even after the infection clears, inflammation in the airways can cause a cough that lasts 4 weeks. This type of cough tends to be worse in the morning and can be confusing because it follows a recent illness. Protracted bacterial bronchitis is another cause to consider. It is a bacterial infection of the airways that causes a wet, persistent cough lasting more than weeks. It is more common in young children and usually needs medical evaluation and antibiotics to clear up. Less common causes include structural issues like airway malacia, where the walls of the airways are weak, or the inhalation of a foreign object that causes irritation. Chronic sinusitis, which is long-term sinus infection, can also lead to a morning cough by increasing mucus drainage. Rare genetic conditions like cystic fibrosis or primary ciliary dyskinesia affect how mucus is cleared from the lungs and can cause ongoing coughs. Sometimes, children develop a habit cough, which is a psychogenic cough without a physical cause. The reason why the cough is often more noticeable in the morning is because lying down during sleep allows mucus to pool in the throat and airways, irritating them and triggering coughing. Mouth breathing during sleep can dry out the throat, making irritation worse. Ensuring good hydration, elevating the head during sleep, and using a humidifier can sometimes help reduce morning coughing. If your child has a persistent morning cough, it's essential to see a healthcare professional for an accurate diagnosis. Treatment depends on the cause, controlling asthma with inhalers, managing allergies to reduce postnasal drip, adjusting diet or medications for GERD, or treating infections appropriately. Remember, every child is different, and a healthcare provider can help find the best plan for your child's health and comfort. Always seek professional advice to ensure proper care and management.